Well, it was 1 year ago today that a critical care nurse in Queens became the first person in the country to receive a COVID-19 vaccine outside of a clinical trial.
200 million Americans are now fully vaccinated, but more than a third remain unvaccinated as cases and hospitalizations continue to rise.
And the UK is reporting its first known death from the Omicron variant. So there is a lot to talk about today with UW Health's Dr. Bill Hartman. Hi, Dr. Hartman. Welcome back to Live at 4.
Thanks for having me.
We appreciate your time. Let's talk about this situation in the UK. Is that a heads up for us, and how concerned are you about it?
Well, we're still gathering information, but the evidence that's starting to creep out is suggesting that Omicron is probably a less lethal, less virulent strain of the virus. We hope that pans out. That being said, it's been a mistake all along to underestimate this virus and what it's capable of doing. And so we have to keep an eye on cases like this where people are passing away. We have to make sure that we stay on top of it so that if Omicron starts to become the predominant form in Madison here, in Wisconsin, in the United States, we're able to combat it.
And when we were introducing you, the line that we had was more than a third remain unvaccinated. So this trial that you're involved with, is that a key point in helping push us forward?
Yeah, tell us about the trial you're doing with young children in the Moderna vaccine.
Right. So the children, they make up a huge portion of the unvaccinated population here in the United States and around the world. So we have to figure out, number one, what's the right dose of the vaccine for these kids, and is the same dose that is for a 6-month-old or a 4-year-old the same as what a 12-year-old or a 15-year-old should have? And so those studies have shown that we can really come down on the dose quite a bit. And so we're trying this lower dose on the 6 months to 4-year-old children right now to see how effective it is and to really reinforce that these are safe vaccines, especially in this population.
That's fascinating. Realistically, how soon do you expect results from the study?
We're on our second injections right now with the kids in this study. So we follow them for probably another month or a month and a half before they can start gathering the evidence on both the safety and the efficacy to hand over to Moderna and then to the FDA for evaluation. So it'd probably be at least late January or early February before the Moderna vaccine would be up for evaluation. I think Pfizer's a little bit ahead of us, so you might be able to see Pfizer coming out into the population probably by the end of January.
And I think you had an important question about hospitalizations to ask Dr. Hartman.
Right. Well, it feels like we're acting like we're done with COVID, but COVID is not done with us. People are traveling and gathering, and cases are rising dramatically, and hospitalizations are as well. What is going on? Is this a winter surge, or is this the Delta variant? What's your read on where we are right now?
Well, it continues to play out that unvaccinated people are really the ones most at risk of being hospitalized and dying from COVID. And at least in our ICUs, that seems to pan out, where many of the individuals, most of the individuals, or predominance of the individuals are unvaccinated. And so that, on top of colder weather, moving people inside, making the virus easier to spread, means more people are going to be infected and get sick from COVID-19. And so we really have to do our best to get the other third of this population in Wisconsin vaccinated so that we can get past this and we can keep people out of our ICUs.
Yeah, I hope so.
Very important.
Dr. Hartman, thanks to you for all you do. We really appreciate your time today. Thank you so much. We'll see you soon.
Thank you very much.